January 1st, 2020, we're celebrating our 50th anniversary, and then all of a sudden, bam, the coronavirus struck.
Coronavirus shift to the United States.
Low-income Americans are bearing the brunt of the coronavirus fallout.
In the 28 years that I've worked at the clinic, it's never been at this scale.
Some of my patients have gotten COVID and died.
I work with a lot of different clients. Most of them are disadvantaged, and then coronavirus happened and all of the barriers and challenges grew exponentially.
Being potentially exposed to COVID was an additional pressure. Having to go to work and coming back home with a small child was extremely difficult.
Working during a pandemic, all of us have been nervous, all of us have been scared. But, we're doing our best trying to take care of our patients.
I'm part of our emergency response team. We got together, collaborated early into the pandemic. We've all had to really redesign our roles in this.
We need to shift all of these pediatrics, adult medicine, all of that has to be moved to telephone and telehealth visits as rapidly as possible. We were asked by the county to become a testing center for the West Side for our homeless clients here. We were asked to do more street outreach because there were encampments on the West Side that were growing. We also focus on food security. We started doing some little pop-up food programs with Food Forward in the fall of 2019. Then coronavirus struck and we went to 600 every week because the West Side Food Bank started helping us. And now we're at almost 2,000 people a week that we're feeding.
We have health disparities that were there long before COVID. This has just highlighted them.
One family had 5 adults and 3 children in a 2-bedroom. So when I'm asking them to socially isolate, it's nearly impossible.
During this pandemic, we've actually really seen what the color of COVID is. We've seen inequalities across many different groups of people, specifically looking at African Americans, the Latinx community, and also Native Americans.
And then sadly, George Floyd was murdered. Especially in a place like Venice Family Clinic. It caused all of us to look within and without. In the United States of America, many of the structures we have are racist. And then the question was, what do we do next? We have to look more deeply. What is bias? What is discrimination? What is racism? We have to really look at our structures here to say, what's working here and what do we need to really revise?
In order to reach health equity, you have to have anti-racism, you have to have access to care.
COVID is saying, look, regardless of your economic status, if one person has it, it can affect everyone. So it is important that we look at healthcare a little differently than we have been doing.
Here we are 50 years later in the midst of a racial and medical care injustice, and unfortunate that we're still facing the same issues.
Justice at its most elementary level means that we care for everybody in our society.
We're all in this together. And so the better we take care of everybody, the better off we all are.